So welcome to the section where we're going to start looking at tracking your consultation sessions. Now, if you look at the Clinics Boost journey, we are now in section 3 of this, where we've been through messages, we've been through tracking calls, and now on to tracking the number of consultations. And you know how it goes. It's quite simple. Start with a definition. So the consultations are where the new treatment plan is offered to the potential patient for the first time. And this is usually after some type of diagnostic session where you have diagnostic images made. There's been a check of some kind in person with the doctor. And usually at this stage, the patient is presented with a treatment plan. This is a treatment plan which they'll eventually sign. Oftentimes there's a price on there, the exact price of what they're expected to pay, and also the exact amount of time that this treatment is expected to take. Okay, and depending on your size of clinic, this is either done. These consultation sessions are done by you, your clinic manager, or the administrational team member, or a combination of all three. So the most typical situation is the doctor the administrational staff would have helped do the diagnostics. The diagnostics were then presented to the doctor. The doctor would give his feedback. Maybe he would do a personal check, and then the patient would leave and actually spend time with the clinic manager or patient manager, treatment coordinator. There are a lot of ways to call this this special person in your clinic, who will sit down with the patient, who's got the time to sit down with the patient and go through the treatment plan and all the costs involved, if there are any. Okay, you can track these as they happen. Just as you know, the simplest way is really just to get out a piece of paper, track them as they happen. Of course, depending on your size of clinic, there are probably not going to be too many of these per day. Smaller clinics range from 1 to 2 to 3 sessions per day. I have worked with clinics that have over 150 new patient consultation sessions per day. So this method would probably not work for them. So they would probably use this separate section where you can track them as they happen. You can see here that I've got this in like this salmon pink colors, the consultation session. So there are 4 during that day, and simply I count them, and then my admin staff would count them and put them into the tracking sheet or submit to the person who is putting that in the tracking sheet. Okay. Now, putting them in the sheet, very easy. There's a appointed person who is appointed to add the numbers to the sheets, adds it to the 3rd section. Very, very simple. And do it every day as we discussed previously. Okay. And the things that we're looking at here are the number of new patients consultation, are the number of new patient consultation sessions too low? Many doctors tell us, that once the patient gets into the consultation session, they're pretty sure that they will go ahead with treatment. So, of course, along this journey, the further they are in the journey, the higher is the chance or the rate that they're going to go ahead with paid treatment. So this number should be high. Conversions from consultations to treatment sessions, is the number too low? If it is too low, then possibly there are two solutions here, which we'll go over in the the further stages of the Clinic Boost method. But look at that number. Is it a problem with consultations, or was it a problem early in the chain? Was it calls to consultations that were the problem? Or maybe this is where your hole is. Or this is the area that you're going to need to work on. And of course, if you're setting goal targets, because you've been collecting these numbers, you'll be able to set targets on what those numbers should be. So is the number of patients in per day or per week for consultations meeting your expectations? If not, ask yourself, of course, what can you do about it? And we here at Clinic Boost have lots of ideas for that, okay? Which we'll get to in further sections. Super. So let's get on to the very next section of the tracking, which is tracking the new patient treatment sessions.